think about how much we depend on our cars to meet our essential needs. Whether it's going to medical appointments, the grocery store, the pharmacy, spending time with friends and family, or anything else, the majority of us meet those needs because we're able to drive ourselves with our own vehicle. But what happens if we lose the ability to drive ourselves? How will we get to where we need to go? The reality is, people in New Hampshire face this dilemma every day. The issue is especially common amongst older adults, individuals with disabilities, veterans, and anyone else who is unable to drive themselves. This is where mobility management comes into play, working with riders and transportation providers to help get people to where they need to go. The role of a mobility manager can be described in three ways. As a champion for community transportation, mobility managers frequently engage with the public to promote community transportation services. This ranges from updating online resources, to tabling at outreach events, to distributing all different types of print media. As a network builder, mobility managers build partnerships with various organizations that have a key stake in community transportation. This applies not just to transportation providers, but also organizations that represent populations that are historically disadvantaged to transportation access, such as older adults, individuals with disabilities, veterans, and low-income families. As a customer support resource for transportation, mobility managers work directly with individuals who need assistance in finding transportation. When someone reaches out, mobility managers will ask about their trip origin and destination, accessibility needs, and purpose of their trip to connect them with the services that best meet their needs. So, what does all of this look like in action? Well, let's hear from the New Hampshire Mobility Management Team on the work they've been doing to help all Granite Staters get the rides they need.
Region 1 and Region 2 are geographically the largest regions in the state. Making up the North Country region are the counties of Grafton, Coos, and Carroll. Currently, these regions are actively recruiting for a regional mobility manager, but that doesn't stop the amazing work from the transit agencies in that area. In the North Country region, Tri-County Transit operates many transportation options. They provide door-to-door transportation, public transportation, a volunteer driver program, and Medicaid non-emergency trips. In this combined region, Janine and her team from Tri-County Transit worked with Ken Gordon, CEO of Coos County Family Health Services, and others from Upper Connecticut Valley Hospital to start a door-to-door medical transportation program called the Coos Non-Emergency Transport, or CNET for short. CNET has been successful in helping patients in the Colebrook and Canaan area make it to their medical-related appointments. In 2024, CNET provided 1,924 trips to eye appointments, dentist appointments, medical and wellness appointments, and also stopped at pharmacies if needed. The response to this service has been received so well that Tri-County added a second bus to help meet the demand. Further south in Lower Grafton County, Advanced Transit provides public transportation for over 170,000 residents in Vermont, New Hampshire, to include Dartmouth Medical Center and Dartmouth College in the Upper Valley. Let's hear about two projects that Adams and his team, in collaboration with Dartmouth Hitchcock Medical Center and the college, were able to implement to provide better transportation service to Upper Valley residents. In partnership with Dartmouth College, the new Pink Route offers enhanced connectivity, ensuring reliable transportation for residents, students, and visitors. Since implementation in July of 2024, Advanced Transit has provided over 28,000 trips on the Pink Route alone.
My region is the Mid-State region, and we're really excited about a new commuter route that we started. It's called the Concord-Laconia Connector. It connects to Concord Area Transit down in Pennacook, and it runs along Route 3 through Franklin and Boscawen and Tilton and Belmont into Laconia. There's lots of places, there's lots of job opportunities all along that route. It stops at the county complex, the nursing home, Veterans Cemetery, It also stops at Walmart and Tanger Outlets and the Belknap Mall. It's free of charge, so take advantage of it. It's there.
Hello, I'm Candy Reed, the Region 4 Sullivan County Mobility Manager. Sullivan County is home to 14 towns and one city totaling 528 square miles with a population of approximately 43,969 people. Southwestern Community Services is the lead agency of the Sullivan County Regional Coordinating Council. This council is comprised of many local stakeholders with an interest in transportation. As a group, we discuss the gaps we are seeing and collaboratively work on possible solutions, as well as discuss who we can reach out to in our region that we could bring to the table to help us with this project. There are several transportation options in Sullivan County. Sullivan County Transportation offers bus rides in Newport, Charlestown, Claremont, and Lebanon. Sullivan County Transportation also is the volunteer driver hub, connecting individuals that qualify for door-to-door services. They currently have 6 volunteer drivers and take approximately 1,500 trips per year, totaling 329 hours and covering over 57,000 miles.
The Monadnock Regional Coordinating Council, or MRCC, serves a geographical area that includes all 23 communities in Cheshire County and 10 communities in western Hillsborough County. Encompassing 952 square miles, the Monadnock region has a population of 101,000. A 2022 transit study conducted by Southwest Region Planning Commission in partnership with the MRCC and transit provider HCS produced a pilot project to implement microtransit services in the Greater Keene area, which includes key destinations in the urbanized areas of Keene, Swansea, and Marlborough. The microtransit zone will serve nearly 1/4 of the Monadnock region population. The expanded Greater Keene services are projected to increase ridership by 125%, from 29,000 rides per year up to 63,500.
Hi, I'm Donna Masso. I'm the Regional Mobility Manager for the Nashua Regional Planning Commission, and I work for the Regional Coordination Council of the RCC 7 here in Nashua, and it's actually Greater Nashua, so it's the city of Nashua as well as the 12 municipalities that surround Nashua. And I help people find transportation, and specifically for senior citizens as well as disabled and low-income people. I try to help them find transportation. And right now, I just want to call your attention to a bike sale that we're having on Saturday, and this is to fund the Gate City Bike Co-op. So it's something that people get free bicycles from the Gate City Co-op, and for so many people, that's their only transportation. So if you have old bikes to donate, please do so. Or if you want to purchase a bike, please do so as well. So if you're in need of transportation, please email me at Donna, DONNA, M @Nashua, rpc.org. Or you can call me at 603-417-6571.
The Southern New Hampshire Regional Coordinating Council, or Region 8, serves 20 communities throughout the greater Manchester-Derry-Salem area. Region 8 spans 608 square miles across 3 different counties and boasts a population of over 350,000 people. Much like all the other RCCs, Region 8 works to address all gaps in transportation services throughout the region. To address this, the RCC facilitated a coordinated, cross-regional initiative with the RCCs of Region 10 and Region 5 to expand transportation services into Region 8. Working with Region 10 and various other stakeholders, the volunteer driver program of Ready Rides was successful in expanding their services into the town of Deerfield. Working with Region 5 and various other stakeholders, the Volunteer Driver Program of Community Volunteer Transportation Company has successfully begun their initiative to expand service into both New Boston and Ware. These coordinated efforts will provide transportation service to a population of over 4,400 older and disabled adults that were previously disadvantaged to transportation access.
The Alliance for Community Transportation, or ACT, is the RCC for southeastern New Hampshire, including eastern Rockingham County, Stratford County, and Wakefield and Brookfield and Carroll County, and is home to nearly 280,000 people. To help answer the question, how will we get where we need to go, ACT launched TripLink and the TripLink Common application. TripLink is a coordinated transportation call center housed at Coast, the region's public transit agency. TripLink books all the rides for clients of Coast, Ready Rides, Meals on Wheels of Rockingham County, Community Action Partnership of Stratford County, and Community Rides. Anyone who needs help finding transportation can call TripLink, and our friendly staff will walk you through your options and can even help you apply. All of the agencies that I mentioned, plus Task Rides, use the TripLink Common application for signing up new riders. By going online to communityrides.org or by calling us at 603-834-6010, new users can find out what nonprofit services they qualify for and get signed up for them all at the same time. In 2024, 688 people used the Common application to register for services.
Thank you for watching. To learn more about the New Hampshire Mobility Management Network and the work being done around the state, visit keepnewhampshiremoving.com. That's keepnhmoving.com.